The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. We're here for the next episode of TMD Demystified, and I am Tony Urbanic. The topic I chose for today is a very sobering, appropriate word, sobering topic, I believe. Possibly controversial, maybe controversial. But today's topic is entitled Amount of Healthcare Dollars Wasted on Misdiagnosis of TMD. As I have traveled for the past 11 years on this journey from actually discovering the basic cause of all the symptoms of TMD, which is inflammation within the temporomandibular joint, not dislocation of the disc, not muscle trismus. That's not the cause, that's the effect. But on this journey, I have been sobered by my observation and realization that, and early on also, but as time goes on, as the years goes on, I become more and more sobered by what I've observed by the huge amount of healthcare dollars that are wasted on the misdiagnosis of TMD. Now, I'm going to tell you right off the bat, I can't even give you a good, let alone accurate estimate of how many dollars that might be. But I can assure you that every year in the United States, it amounts to millions and millions, if not a billion or more dollars per year of healthcare dollars. One way or another, they're your dollars or your employer's dollars, or the government's dollars, which are your dollars. Everything boils down to it's basically your dollars that are wasted on the misdiagnosis of TMD. Now, I have brought this to the attention on several other episodes. The first one was probably about 2 or 3 months ago, entitled, Poking the Bear, basically talking about the actual misdiagnosis of the problem. But this episode, I'm going to try to outline, describe, unpack the concepts which will bring you to a realization of the amount of money that is actually wasted on the misdiagnosis. And then if you want to grab a pen and pencil, you can kind of start calculating some of this yourself, what it might be. But having the ability over the past 7 or now approaching probably 8 years since we really started getting traction on seeing a lot of temporomandibular joint patients for the treatment of non-surgical TMD, and taking, up to now 5,000 or more histories from these patients. And the histories have more often than not included a circular path that these patients have followed since a misdiagnosis that can go back 20 or 30 or more years, decades, that they have traveled and seen multiple practitioners and had multiple procedures and multiple different diagnoses that have not been effective because they didn't address the actual cause of the problem, which was inflammation in the temporomandibular joint. That is just a fact. Now, yeah, so it's sobering. And frankly, from my viewpoint, as both a dental professional and a medical professional, trained dentally, trained medically, and also academically, it's very disappointing. As I went on this journey, I became more and more disappointed At one point, and I won't go deeply into this part of it, I think I have commented on it in an earlier episode, but just really a comment. But at one point, I went toe to toe with a major insurance carrier trying to describe for them, outlining what I discovered, and mainly the huge amount of money that they could save their customers, you, and the companies that provide dental insurance, a huge amount of money that they could spend if they made an effort to, ensure or go toward proper diagnosis of TMD rather than misdiagnosis of these symptoms. To put it mildly, and I do mean mildly, they were totally disinterested in hearing about it, didn't want to hear about it. That was many, many years ago. And I'm not going to mention the name of the company, but if you want to contact me personally, I'll be happy to tell you. And I'll give you the whole history, because it went on for 2 to 3 years before it finally came to a head or fruition. And they made it clear they were not interested in discussing how they might save millions and millions of dollars. In any case, title of today's episode is Amount of Healthcare Dollars Wasted on the Misdiagnosis of TMD. We absolutely know that there are a huge number of patients that are misdiagnosed. In fact, most, not all, but most, I would say at least 80% of the patients we see in this practice, and I have seen personally over the past years, have at one time or another been misdiagnosed for the symptoms they present with. And sometimes sooner or later it gets sorted out, sometimes after seeing multiple doctors, multiple clinics, and sometimes not. And sometimes the misdiagnosis goes on for 2 months, and sometimes it goes on for 40 years, 4 decades. All right, I made the point. So I've kind of made some notes for today. I've just collected 1, 2, 3, 4, 5 categories, and there are multiple categories beyond 5 of the misdiagnosis, because again, we know what the usual and customary symptoms are of TMD. I'll just run through again, and that's the disparate symptoms are really what gets everybody confused to begin with. And the well-known, well-accepted symptoms of TMD are frequent or recurring headache, earache, jaw pain, neck pain, subjective hearing loss, tinnitus, and vertigo, upper back and shoulder pain, arm, hand, finger tingling and numbness, and various times of walking. Those are the disparate symptoms. So I can understand where healthcare providers, if they treat those symptoms from time to time that are caused by other, that are associated with other diagnoses, then they jump to the conclusion if they have shoulder pain or neck pain, well, I know what that is. It's a disc problem. And so they treat a disc problem rather than actually look for differential diagnosis. This may be inflammation in the temporomandibular joint. That's the issue. And it applies to multiple categories, but I picked out 1, 2, 3, 4, 5 we're going to talk about briefly to make my point. And the point will be, hopefully, when we conclude that yes, absolutely, there must be millions and millions and millions of dollars every year in the United States that are wasted. And I have to say, my calculations show maybe approaching $1 billion or more per year when you include not only treatment, practitioner cost, hospital costs, drug costs, and costs of different interventions and diagnostic procedures like MRIs and CT scans. All right, let's start out with the migraine headache. That is the most common. It is the most, frankly, egregious, because the doctors and researchers who study migraine headaches will be the first to admit they do not know what causes migraine headaches. They have lots of theories. They frequently call them trigeminal vascular headaches, because they feel, or their data points them in the direction. It must have something to do with the trigeminal system and the vascular system. So they call them vascular trigeminal headaches. I'm not going to deep dive into the anatomy and physiology of that. I can see how they would say that and be confused. But migraine headaches are very common. In fact, more common in women than men. The statistics are there. I'm not going to try to quote a bunch of statistics today. That's irrelevant. If you want a set of statistics on any one of these, you can Google it. Everything is available on Google. The statistics, statistics can lie, statistics can vary, but there are multiple statistics on everything that I'm going to talk about today. I'd suggest and encourage you to look them up yourself. And you can calculate numbers if you want off of those statistics. Migraine headaches. Most commonly treated with drugs. We see at least 60 to 70 to some, maybe as much as 80% of the patients that we see on a day-to-day, week-to-week, month-to-month basis who have TMD, who have inflammation of the joints, who have hot joints, who have a multitude of those symptoms, not just migraines. So they have other symptoms associated with TMD, and that they come in here, like I said, 60 to 80%, and they have been diagnosed with migraine headaches and being treated for migraine headaches, either currently or in the past. Many of them have been placed on migraine headache medication for quite some time, for years, and quite frequently, after a while, they stop the migraine medication because of some of the rather significant side effects and the lack of results. Not saying that medication cannot give you some effect on headaches, for sure. The point being that it's much easier, much better to actually address the point of origin of the headaches by decreasing inflammation in the joint rather than just covering up the symptoms with medications. Some of these medications are extremely expensive. But beyond medication, I have even seen patients treated with unresolved, recurring, severe headaches. And we know that TMD headaches can be recurring and severe, life-altering headaches. And actually, I have documented 2 patients in the Middle Tennessee area who have been treated inappropriately and misdiagnosed with Chiari malformation, which is a neurosurgical problem where the brainstem is affected and perforates or goes down the foramen magnum, which the Chiari malformation can cause headaches, but was misdiagnosed. And 2 patients I can document who had obvious other symptoms plus a hot temporomandibular joint ended up in our offices and had previously had neurosurgery for Chiari malformation. The expense on that, and that's the point, is how expensive is this? How expensive are the millions of patients, primarily women, who are placed on migraine medication, which originally, or the initial cause is temporomandibular joint inflammation, or just 2 particular cases that went through neurosurgery, a trip to the hospital for neurosurgery and this issue, on this issue, I would estimate someone, primarily an insurance company, between the neurosurgeon, cost of the provider, the neurosurgeon, and the hospital, and all the medications that went with that, would be somewhere between $100,000 and $200,000 per surgical procedure total. So on these 2 particular cases, it would be between $200,000 and $400,000 to do 2 separate neurosurgical procedures for Chiari malformation. And that's not counting the patient's cost, which would be downtime from work, assuming that they work or worked, the pain, quote, suffering, difficulty that the patient went through, and any potential side effects from that surgery, because that is a very big neurosurgical procedure. So I have no idea. I do have an idea. I had both of those patients sitting in my office, and they obviously were sitting in my office because they did not get resolution of their headaches. And when examined by history and physical examination, they obviously had TMD. So, and like I said, 60 to 80% of the patients that we see here have been diagnosed, some of them self-diagnosed, most of them physician diagnosed with migraine headaches. Next category would be earaches, almost as common as, well, migraine is way out ahead, but earaches that have been misdiagnosed as ear infections, extremely common. The scenario there is patient has earaches, they go to the convenient care clinic, the walk-in clinic, the nurse practitioner or physician's assistant looks in the ear. I do not know what they actually see, but if they have an earache, 9 times out of 10, the practitioner is going to say, you have an ear infection, and you're going to walk out with a prescription for antibiotic. We see that so often, I expect it. I mean, patients, so many patients give me that history, and they have so many patients, they say, well, I've seen 2, I went to 2 clinics, I went to 3 clinics. Finally, one of the practitioners said, I think you need to see an ENT doctor, after 2 or 3 visits to convenient care clinics, at which point they get an appointment to an ENT doctor. At that point, 1 of 2 things can happen. The ENT doctor can get very suspicious, depending on his point of view and experience, and get really complicated to the point where they start doing significant workups, for example, looking for acoustic neuromas. First thing you're going to order is a $2,000 MRI. Unresolved migraine headaches or unresolved earaches. Very often in the ENT's eyes, this may be an acoustic neuroma, which is a significant problem, and that does happen. But certainly it would be easy to rule out, acoustic neuroma and rule in temporomandibular joint problems if the ENT doctor would just do that, collect the symptoms that the patient may have, and say, you know, I might be suspicious of an acoustic neuroma, but I'm much more suspicious that your ear pain is coming from the temporomandibular joint. And that happens increasingly frequently now here in Middle Tennessee because of our efforts to educate the otolaryngologist about this problem, both at Vanderbilt and in the private sector. And we're getting increasing numbers of ENT doctors who are aware of what we do and how we do it, and how to differentiate other problems from temporomandibular joint issues and TMD. But the amount of dollars that are spent on MRIs looking for acoustic neuromas, or the huge number of people that go to walk-in clinics complaining of ear pain and walking out with an antibiotic, which is not going to be effective at all. And I hear the stories. I went to 2 or 3 clinics before someone said, this might be TMD. And then they get into CS. So how many patients? I mean, just in Middle Tennessee, I mean, hundreds. I can document hundreds and hundreds in Middle Tennessee. You multiply that out into throughout the United States and Canada, the developed world. You can see that this can mount up very rapidly just with the misdiagnosis of earaches. The next category I chose, again, there are more than 5 categories, but something that I did research pretty carefully about this was Meniere's disease. Now, I've talked about Meniere's disease in other episodes, but now we're talking about the number of dollars that could be literally healthcare dollar wasted. And Meniere's disease is, by definition, tinnitus, ringing in the ears. The definition of Meniere's is these 3 symptoms: tinnitus, subjective hearing loss, and vertigo, dizziness. You don't have to have all three symptoms to be diagnosed with Meniere's disease, but if you have all three, that is helpful, and that is the definition of Meniere's disease. In Meniere's disease, the workup certainly will include a CT scan. We're going to rule out acoustic neuroma. There can be some other rather expensive diagnostic studies, trips to the audiologist, and other treatments for tinnitus or vertigo. And over a period of time, because it is fairly common to misdiagnose Meniere's disease, and the ENT doctors admit they do not know what causes Meniere's disease, I submit that there needs to be a study to determine if Meniere's disease, those three symptoms, if there are other causes for the symptoms. But we know that ringing in the ear, subjective hearing loss, and vertigo clear, literally the symptoms clear when inflammation in the temporomandibular joint clears. And those symptoms will go away over time, slowly for sure, but they do diminish. Symptoms do diminish with time. Again, how do you calculate the number of dollars spent there, the number of MRIs, the number of patients? It quickly adds up. And most of it is paid by insurance companies, who I already commented. It appears that they're not interested in finding out. The next one I have also a lot of familiarity with, and that is neck pain. Neck pain is the second most common symptom by my observation over 11 years dealing with this on the journey. Neck pain is the second most common symptom of TMD. Neck pain certainly has other causes, trauma, spurs on the cervical spine, but it is commonly misdiagnosed as other things having to do with the C-spine rather than inflammation within the temporomandibular joint, which then leads to the trismus of the neck muscles and shoulder muscles, which cause pain. And so, the worst cases are, and we have seen a few that have actually had neck surgery, and they may or may not have had visible X-ray, visible spurs on the C-spine at different places, or had a collapsed disc somewhat. But surgery was done for the neck and shoulder pain, which did not diminish. And then they ended up sitting in our office. Certainly they had hot joints. They had other symptoms besides neck pain. Diagnosis of TMD was made. And when you unload the joint long enough and the inflammation goes away, magically the neck pain diminishes. So how much is spent on that kind of treatment? Well, physical therapy. I mean, the average visit to a physical therapist, multiple visits to physical therapists once the referral is made can be between, 5 and 20 visits at $75 per visit. Chiropractic care, you can estimate, what that might entail, and can go on for years. All this comes to mind recently. Yesterday, I see patients on Monday only now. And I had a patient who told me that she had been seeing a chiropractor for 2 years, among other things, among other professionals that she had seen for the multitude of disparate symptoms, but she focused on her neck pain for a moment. And she said, "Oh, well, I've been seeing a chiropractor for 2 years." And she definitely had TMD. Massage therapist, that is usually not covered by insurance and borne by the patients themselves. Speaking of this patient yesterday, it was fresh on my mind. She said, I'd been through physical therapy and chiropractic therapy, and I have a routine massage therapist. Well, that is borne by the patients themselves. You start adding this up and you have hundreds, thousands of dollars per year. That is not effective, essentially wasted on treatment or diagnosis. Of course, neck pain can be treated by multiple types of drugs. And then surgery itself, I already commented on, disc decompression or nerve decompression, and you get really expensive. You're going to spend $50,000 to $100,000 to $150,000 per surgical procedure to do something like that. And then the final one I want to talk about, and again, briefly, and just mention it because if you treat TMD people, you will see absolutely, and it won't take long, like within the first two, you're gonna meet people who have been misdiagnosed with migraine headaches, earaches, Meniere's disease, and neck pain. And the final one that is not as common, but is a real catch-all and a real misdiagnosis and can be a very serious misdiagnosis. And I'm gonna give you just a simple example of this that occurred in our practice 2 weeks ago. And that is a misdiagnosis of the catch-all, because it's a catch-all of trigeminal neuralgia, tic douloureux. Facial pain that is diagnosed as tic douloureux or trigeminal neuralgia it commonly works like this. If you go to a family physician or a walk-in clinic or your PCP and you say, I have pain here, I have pain here, they may talk, you may think it's sinus, then they're going to do some sinus x-rays. You may say, well, it hurts every day right here. Very commonly, that catch-all diagnosis of trigeminal neuralgia, tic douloureux, is going to be placed on you. At which point, and tic douloureux is by definition a very specific kind of pain, very specific. So let me just give it to you so there's no misconstrue what I'm about ready to say. Tic douloureux, the patient will tell you, you can't touch right there. You will have a trigger point, not multiple trigger points, not like, oh, don't do that. We're talking about don't touch that right there, or don't touch that right there, because it will send and just exquisite, rapid, painful symptoms. That's the definition of tic douloureux. Honestly, I have never seen a patient, and that's how it's described in the literature. That's not my description. The description of literature is, don't touch that. That will send me into hell. That's how it's described. All of the patients that I've seen with all the different kinds of descriptions and their complaints about facial and neck pain, headaches, pain behind the eyes, all this stuff, I have never actually seen a patient with true tic douloureux. Maybe I just didn't see enough patients yet. That may be true. But tic douloureux is a catch-all in the medical profession. And if you have facial pain, more often than not, if it's not obvious or the doctor isn't enlightened to some degree or another, he's going to call it tic douloureux. So we see a lot of people coming in with that diagnosis. How much does that cost? Well, I'm just going to give you one example. And again, how many of these times how much of this is multiplied throughout the different metropolitan areas, throughout the country, throughout the world? I can only estimate. Frankly, your guess is as good as mine. And anything that I would say would only be an estimate, and it is a guess. But in this particular example, let's talk about a patient that I saw a couple weeks ago. This patient, and I just saw her yesterday, by the way, she got a device. She's beginning to get better significantly. I think yesterday, her comment at 3 weeks, because it's been more than that. It's been a month since I've seen her. So she's had the device for 3 weeks, and her comment at 3 weeks was 50% of her symptoms were diminished or gone at 3 weeks of the original symptoms. This particular patient went through 3 separate medical procedures. The first was a chemical rhizotomy. Basically, alcohol was injected at the base of the fifth nerve because she had the diagnosis of tic douloureux. Now, when I saw her and when I diagnosed her, first of all, because she had a chemical rhizotomy of the fifth nerve, her entire was her right side. Her entire right side was numb. She had no feeling on the right side of her face because of the chemical rhizotomy, which is supposed to resolve within a few years. And her chemical rhizotomy was placed, was done, I'm trying to remember, 7 to 10 years ago, long time ago, and it did not resolve. Her face is still numb. She still had the majority of her symptoms of headache and earache and neck pain. She obviously had TMD, but the rhizotomy was not her only surgical procedure. Then approximately 2 and 3 years ago, she went to a specialist who I will not even talk about the city, but his particular procedure that he developed a reputation for was fifth nerve decompression. Basically a neurosurgical procedure to go in at the base of the fifth nerve and decompress it as it exited the skull. That is a big procedure. And actually, she had it done twice. She had it done once and it didn't resolve the problem. And she had it done twice, second time. And she, as she gave me her history and I uncovered all this, I was frankly dumbfounded. Just really felt for the patient. And I won't go too deeply into that, but it is sobering. But today we're just going to talk about not that part of it, the cost. How much does 2 neurosurgical procedures to decompress the fifth nerve and a chemical rhizotomy cost? Again, I'm estimating those 2 procedures, especially the decompressions, they were between $100,000 and $200,000 of total cost to somebody at some time, mostly insurance companies, which are your dollars. All right, I've droned on too long, frankly. You get the point. I hope you get the point. Millions and millions of dollars. Now, why should you be interested? I don't know. I know why I'm interested, because I see that it's a problem that needs to be fixed in our medical and dental professions. The real problem is that, and the reason I do these episodes is that the dental profession is the only profession that can actually take responsibility for the problem. The medical profession is not going to be involved, does not want to get involved. That is not in their wheelhouse of treating inflammation within the temporomandibular joint. However you want to treat it, surgically or non-surgically, we've covered extensively. Surgical intervention is not the answer. And we have developed a way to unload the temporomandibular joint adequately to allow the inflammation to decrease. And the inflammation, as it decreases, the inflammation, the symptoms go away. The inflammation and symptoms diminish. The amount of dollars that's potential to be saved is in the millions and millions and millions, if not approaching billions per year. I claim that. I stand by that. I already said your exact estimate and guess is as good as mine. There are people that probably would like to sit down and try to figure this out. I encourage you to do that if you want to. With that being said, I have made my point. I hope it has landed in the way it's intended, which is help, not criticism. It's done for help, not criticism. So until the next time I have an opportunity to talk with you, I can be reached at tony@tmjservices.net. I'm open for criticism. I'm open for comment. If you'd like to contact our Director of Marketing and Education, if you'd like to have her do a lunch and learn and go through our process and what we know about this for your practice, she can be reached. Naomi can be reached at naomi@tmjservices.net, our website, www.tmjservices.net. And for today, I look forward to the next time we're gathered here together to listen and learn, hopefully, at our podcast, TMD Demystified.